Okay, good morning. My name is Kim Johnston, and I'm in the Murray State University RN to BSN program. I am going to demonstrate today a PowerPoint of bridging the gaps between nurse and provider. This was a very important topic that I chose because I feel like it's more of a problem than really what people realize. I have two friends that are nurse practitioners, and they speak of this problem often between their staff and themselves, so this is the reason I chose actually this topic. Communication is an important part and component in patient care. It's involved in almost everything we do. If we do not communicate correctly, then we cannot get the point across and therefore to have a successful outcome. Nurses must possess skills of critical thinking, delegation, supervision, and above all, communication to work with other disciplines. Because in healthcare, there is so many other disciplines beside nursing that is involved with the physician, a provider, a nurse practitioner, the nurse aide, physical therapist, occupational therapist, respiratory therapist, dietitian, and so on and so forth. So it's imperative that we communicate effectively. This is a diagram that I thought was very interesting that speaks about effective communication. To have effective communication, we have to have the technology behind it. With today's world, it is a fast-paced. With my students that I teach now, they know far and beyond more than I do about the technology because I didn't grow up in an era that had technology. We have cell phones now that are unbelievable on what they're capable of doing. There's laptop computers that are very mobile. There's iPads. There's tons of other things that we use in healthcare now. It's used with telemedicine, with lots of different things. So to keep in the forefront of technology is very important to stay current, and that is a very important component in healthcare now. With technology, that also is going to help with efficient patient care. In a lot of facilities, there is mobile computer units that is taken from one room to the next. There is newer hospitals and facilities. There is actually areas where you can pull down a desk in the room that has a laptop computer or a desktop already set up to where it's very efficient and helps the nurse to be efficient in her care, so you don't have to stop and start and stop and start. When I started nursing, we documented at the end of our shift, and these days I know nurses and other team members in the team can document at the time the service is done because of the easy access with the mobile accesses that they have now with technology. It also increases their productivity. You can get a lot more things done at the same time with the technology and if you communicate correctly. And with this, you're going to hopefully have a successful outcome. My project plan was to discuss with the nurse and the provider current ways of communication. Until you actually speak with the staff members and people that are involved, you truly do not get a gist of really what goes on and what the problem is. So I actually interviewed staff to voice their concerns in the workplace. I interviewed two CNAs and one provider to get their take on what they thought the problems were, and all of them actually gave a different scenario, but really it was very comparable to each other because they talked about the communication barriers. I reviewed the current computer technology in the facility and realized that a lot of things were outdated, There was only 1 or 2 desktops, 1 laptop in the facility, and there's a lot of different staff members that work there. So we come up with a plan to where others could have access to technology as well. And I also developed a way to communicate about upcoming events and schedules. There seemed to be a barrier and a gap in communicating about things that were going on because, you know as well as I do with your job, there's many things behind the scenes that you're responsible for besides just your day-to-day operation. So we need to develop a way to communicate on a daily basis with some kind of event planner. My project objectives was to provide a nurse the provider and nurse will identify communication barriers. Also, the staff will be equipped with updated computer technology to enhance their communication. The nurse will demonstrate at least 3 interventions to address variances in the communication. And I think we achieved these. My synthesis and evaluation. The closing communication gaps, of course, is what we want to do. We do not want to keep those gaps open. We want to have reasons to keep up with technology in the workplace. We're going to talk about effective communication in the workplace, address barriers to those communication barriers, and how to communicate better at work. So, first of all, closing communication gaps. We want to improve the overall communication among staff because even though it's different disciplines, you have to learn to work together. The nurses and the providers there at the community center that I shadowed and observed with my mentor was very hands-on. They developed relationships. They were very respectful to one another, but they couldn't really come together to learn how to communicate because each discipline was so busy. So we developed ways to where we kind of stop and take a look at what's going on to address those issues. Effective communication among staff is essential for success. There's no way around it. We all have to communicate in an effective way, especially when there's patient care involved. Technology solutions can facilitate and improve communication and support initiatives. Again, as I spoke of earlier, technology is just imperative to have in our facilities now to help with productivity. And then there's the direct conversation between nurse and providers should remain the standard of care. We want patient care to be the primary source because if we didn't have the patients, we wouldn't have our jobs. So we want to have conversation between the nurse and provider about those patients. Technology in the workplace. We want to stay relevant with what is new and improved. What is the newest and upcoming technology that can be utilized in such a way to benefit our facility. We want to have good communication. We want to stay organized. And that sometimes is difficult because of the various busyness that gets tossed about in our workplace, and some things can get put by the wayside and really not even meant to be. And we need to stay in touch with one another. There is things that the Community Health Center does as a staff. They have meetings on a regular basis. They have meals on a regular basis. They connect with doing Relay for Life and other issues in the community so they can work and stay grounded as a staff. And then keeping up to date with the latest platforms in technology. Effective communication in the workplace. Communication in the workplace is essential. Workplace culture can be affected by poor communication. The overall feel and environment of your facility can be affected because lack of communication. So we have to learn how to communicate effectively because of that. Poor communication can increase the employee turnover. There may be an employee, they can find another job if they're dissatisfied, so we want to keep satisfaction up. We do not want to impair customer service, because if we're not setting the example, and usually nothing even has to be said. Nonverbal communication speaks louder than words sometimes. So if your customers, your patients, your residents, those that you're taking care of, can read that on your face, they're not as likely to want to be your patient and to be your customer. And then also it's going to diminish productivity. Barriers to effective communication is not listening. That is, sometimes we get so busy and just talking and talking and talking, we're not stopping to really listen to what our patient says and our staff says. So it's important to stop sometimes and take a breather and count to 10 and stop and really listen to what's being said. We don't want to make assumptions, because a lot of times you can make assumptions of what you think is going on, and it's right the opposite. So we don't ever want to assume. That was one of the things early on in nursing school that we were told, never to assume anything, because everybody has different perceptions of what's going on. There may be some ineffective questions that's asked, so we want to make sure we always ask the right questions and have open-ended questions. Information overload. We never want to overload our staff or our patients with information. Sometimes things have to be given in segments. So if during a meeting there's a lot of things that needs to be spoke about, you may have to put that in segments, do a certain agenda to where the staff knows ahead of time what's going to be spoken about in the meeting. Emotional distractions, that's a tough one, because we're all dealing with different issues because of the crazy world that we live in now, and we need to really put our emotional distractions and leave those at home, because they can really impact our staff and they can impact our patients, our customers. Conflicting messages. It's like the right hand doesn't know what the left hand's doing, or you're talking out of both sides of your mouth. Maybe your tone says one thing, but your words say another, or your body language is saying another. So we need to really have an awareness of what our body language is saying, because it can really send a different message than what's supposed to be. And then our perception again. So how do we communicate effectively at work? Strategies to keep in mind is we want to always keep a positive attitude. I read something just the other day that says what happens to us 99% is 10%, and our attitude is 90%. So we can either see our glass half full or half empty. We need to really keep a positive attitude and atmosphere in our environment, because that's going to attract our patients and our customers, and then that's going to want our staff to work with us as well. Being open-minded, asking open-ended questions, never just closed questions where there's a yes or a no. Something for conversation. Stay patient-focused. It's not about us. It's about our patients. That's why we become nurses today, is to involve patient care. And also a team approach. It needs to be a team approach with anything we do. We need to collaborate with other disciplines and keep those involved, because they may have more information, perhaps on nutrition. It could be a dietitian. If it's with a provider, that could be because of maybe their medication regimen or something. Physical therapists could be more on exercise and range of motion. So we need to involve other disciplines and remember that it's definitely a team approach. The nurse to provider communication. How do we communicate? We need to listen effectively. We need to watch our nonverbal communication, just like I spoke a while ago with our body language. We need to manage our stress level. It's very easy in the workplace to maybe verbally attack someone in a way that we didn't really mean to because of the stress level that we're under. So we need to channel that healthy. The emotional awareness as well, and then mutual respect goes a long way. Okay, we want to treat others the way that we want to be treated. Key findings was interviewed the staff members, and I spoke about that a while ago, that they had similar interests, but the bottom line I felt like was the communication barriers. Current technology is not efficient. There's poor communication between the staff. The scheduling conflicts, we found that there was a CNA was assigned to different providers every day. So they never really got that community, they never got that relationship with that provider, they didn't learn that provider. And so we developed a different way of scheduling. And then there was no systematic way of operation at that facility. The evaluation is the problem of ineffective nurse-provider. Communication impacts patient care and disconnects staff relationships. And communication is essential in healthcare, and using current technology is necessary in today's society. Conclusion, this is actually the staff members that work there at the Western Kentucky Community Health Center that I really enjoyed meeting, and they worked really well with me. This is Miss Penley and Miss Kirby, Jackie Kirby. I did not, Miss Kim Penley was my mentor, but I did watch and monitor Miss Kirby as well, and then those are the CNAs that was their helpers as well. So what did we do? Each provider was assigned a CNA, and that they kept that person the whole time. So they are not going to rotate anymore. They're not going to switch. They're going to stay with one provider. This one in the middle is actually going to rotate back and forth, but this CNA will stay with Miss Penley, and the other CNA will stay with Miss Kirby. And they really like that idea. That way they can develop a relationship, can develop a rapport. They're going to learn that provider on what they like and don't like, and hopefully that will speed up the efficiency and productivity as well. Each nurse and provider will have a laptop computer. So that was actually in the works when I came, and it was actually completed before I left, that they had those laptop computers, and they're all very happy with that. They can communicate back and forth on just minute to minute. So it may be that Miss Penley is in one room and she can actually converse back with her CNA through the laptop computer with notes and various things where they can communicate ongoing all day long. So they stay very intertwined in their communication throughout the day, which really helped. And then we developed a calendar that will be posted with the events and the reminders. This calendar was a very good tool to post in the facility that showed upcoming events, and it's posted out where everybody can come through and see that. I also encourage them to put some kind of daily inspirational quote on there, so where that can be read, and you know, we all need to be reminded sometimes of how we should act. So those kind of reminders was really good. Recommendations is to keep the lines of communication open and maintain relationships. Relationships is what it's all about. If we can't connect with someone, then we're more than likely are not going to be able to communicate. So those are my references, and I hope you enjoyed this presentation. It was definitely a learning experience for me. I learned a lot from doing this mentor project, and I hope you enjoyed it. If you have any questions, please let me know. Thank you.